Are you able to see?
Yes, ma'am.
Yes,
Hello?
ma'am.
Yes? Uh,
Yes, ma'am.
okay, just a minute. You're able to hear me?
Yes, ma'am.
Yes? Okay, right. Um, yeah. Is the slides visible?
Yes, ma'am.
Yes, right. Today's topic of discussion is basically monitoring, right? How
Yes,
we
ma'am.
go about monitoring the implementation of biomedical waste management rules of 2016. Before we go to the aspects of monitoring, I'll just touch upon what the rule says and let's see from there. Okay. Now, earlier, now this BMW rules are applicable to all these places. BMW rules of 2016 is applicable for a hospital, nursing home, clinics, dispensaries, veterinary institutions, animal house, pathological laboratories, blood banks, clinical establishments, research or educational. Now, these were there even earlier also. The ones you see in the red one, that is Ayush hospitals, health camps, medical and surgical
Next slides
camps.
are not visible.
Yes,
Next slides are not visible. Only this
slides
one
are
is
not
visible.
visible. It's not going,
It's not moving, ma'am.
it's not moving.
Now it's moving, ma'am.
Now it is moving. Okay, shall I keep it like this only?
Yes, ma'am.
Is it visible?
Yes, ma'am. That's visible.
Okay, so now what the things you find in red here are the ones which have been added by the rule of 2016. So Ayush hospitals, health camps, medical and surgical camps, vaccination camps, blood donation, first aid rooms of school. That means to say what, even in these areas also you need to take authorization for biomedical waste management. Okay, so now we all know what is the definition of biomedical waste. I'm not going into it, but since we are looking at monitoring, there are stakeholders, that means people who generate waste, and another set of people who basically handle or manage biomedical waste, that is a common biomedical waste treatment facility person. The people who generate waste are mostly called as occupiers. That is, all the hospitals, any administrative head from a hospital is called as an occupier. Clear? So, any administrative control over the institution or premises generating biomedical waste includes hospital, nursing home, clinic, dispensaries, veterinary institution, animal house, pathological. All these people whoever is administrative have administrative control over that particular hospital or a diagnostic facility or anything, they will be called as the occupier. What are their duties? Now, for us to implement it properly, we need to know what are the duties and responsibilities of an occupier, duties and responsibilities of an operator. Operator is the one who owns the common biomedical waste treatment facility or any place where this biomedical waste is managed, treated, and final disposal mechanisms are done. Those places are the ones, the administrative control of those places are the ones whom we call them as operators. Now, occupiers are for the healthcare facilities. Now, what needs to be done here is by an occupier is they need to provide a place for storage, they need to provide facilities for segregation, they need to train the people for segregation, appropriate segregation. When you say facilities for segregation, they have to provide bins, they have to provide liners, and they should also make a space for temporary storage room, which is also mandated as per the rules. And they should also phase out all the chlorinated plastic bags, gloves and blood bags that are there. Immunization of the health workers, ensure there is occupational safety of all their healthcare workers. They have to provide health checkups, and they also have to ensure that there is a barcode based software system that is established in their hospital during the transportation of in-house transportation of waste. Now, what all they should also do? They should display the waste management monthly record on the healthcare facility website. They have to report any major accident, and they should ensure that the waste is also lifted before for beyond it is not stored beyond 48 hours. Report to the SPCB in case of irregular visit of the common biomedical waste treatment facility. They have to form a biomedical management committee or a hospital infection control committee, which also oversees the biomedical waste management and the labeling of this waste. These are some of the duties of an occupier. Now, what is it that these people need to do is to establish, any small 30-bedded ones should have a committee, example of a waste management committee, which is headed by the medical superintendent. You will have a hospital nodal officer, sanitary supervisor, store in charge, members from other department, medical director and administrative head, and epidemiology nurse or the infection control nurse. These will all be the members of the waste management committee. Sometimes in most of the hospitals, you may not have separate waste management and infection control committees. So what is the role of these waste management committee people? They should see within the hospital that the waste is appropriately segregated, it is transported properly within the hospital and stored properly and handed over to the common biomedical waste treatment facility. They should ensure that the records of all these people have been maintained. The records of generation of the biomedical waste is maintained. Compile these reports and then prepare an annual report which needs to be sent to the State Pollution Control Board, and from the State Pollution Control Board it goes to the Central Pollution Control Board. Okay, they should ensure that their hospital has authorization. Authorization means it is just not for the I'll come to the authorization a little later. And what are the other functions of this committee? They should, train every member of the new people who come there regarding biomedical waste management, and they should also provide occupational health, provide facilities for personal protective equipment for those who are personnel who are handling biomedical waste, right? So these are some of the, they have to frame policies, they have to frame standard operating procedures for management of biomedical waste in their respective facilities. These are some of the activities that this committee should or will perform in a hospital. Some hospitals may integrate this along with the hospital infection control committee. Now, this is necessary only if the hospital has more than 30 beds. For less than 30 beds, if they just have one person who can coordinate the biomedical waste management, it's more than enough. The medical officer or the medical officer would be the chairperson of this, who would overlook and who will be responsible administratively for implementation of biomedical waste. Okay, so this is for more than 30 bedded hospital, which is generally used. Now, authorization. What is authorization? Every facility which is generating, collecting, reception, storing, or transportation or disposal of biomedical waste should get authorization from the respective state pollution control boards or the control units, whatever you call them. Right? They'll have to make an application, and then for non-bedded occupiers, it is just one time it is. So these are all mandatory for every healthcare facility to do it. And they should also submit an annual report in Form 4 before 30th of June every year. Okay. And it should be, this report should be displayed on their healthcare facility website within 2 years. For 2 years. Now, what are all that is there for to write in the annual report is that they need to tell the quantity of general waste from monthly basis, size and capacity of on-site storage room, minutes of the meeting of the biomedical waste management committee, details of the training that has been conducted, any major accident, or whatever is the liquid treatment methods in place. So your annual report will contain details of all these things. All right. Now, what are all the records that we need to maintain as an occupier? As an occupier, I will have to maintain records with regard to how much I am generating, how much is being collected by the common treatment facility, the storage point, transportation, what form of transportation is there, any on-site handling or disposal that we are doing. All these things should be maintained for a period of at least 5 years. Remember this, or the ones in red. It has to be maintained for 5 years, because any time when they come for monitoring, they can check these records. So what are all the forms that are there in the rules? Form 1 is for accident reporting. Form 2 is for application of authorization or renewal of authorization. Form 3 is authorization again. Form 4 is annual report. Form 5 is appeals. Okay. So there are 4 schedules in there. Schedule 1 is the segregation part of it. Schedule 2 is the standards for incinerator, autoclaving, microwaving, deep burial. Now, one more thing what we need to remember as occupiers is that we need to pre-treat some waste and then send it across to the common treatment facility. When we are pre-treating certain waste, we may use an autoclave or we may use a microwave or any other dry heat sterilization or any other method, or a chemical method that we have used. We need to maintain the standards for those pre-treatment also. All right, so we need to maintain how much pressure we have maintained, what is the temperature. All these things have to be maintained at the pre-treatment facility also. Now, schedule 3 prescribes the authorities and the corresponding duties. Schedule 4 is this. So this is with regard to duties of a occupier is that of a hospital. Now, in the hospital, these are all the things that we need to maintain specifically, because when we come for monitoring, when the State Pollution Control Board members come for monitoring, they ask for all these details. They ask the annual report. They will ask how much of waste is being generated. They will check the segregation, how is it being done at the point of generation or not, whether the color code is being maintained or not. What are the plastics, whether is there a storage room. All these aspects are actually checked by the people who come for monitoring. All right, so at the same time, monitoring cannot happen. If you want to look at the rules from the generation to the final disposal level is what we need to look at, isn't it? So generation point, you have somebody monitoring it, because every hospital can have their own methods of monitoring systems that are there. And even the regulatory bodies also can come and monitor. uh, who will monitor the operator or the common treatment facility? There are the regulatory bodies are the ones who will monitor the common treatment facilities. There are certain things which even an operator of a common treatment facility also should maintain. So what are they? These are the duties. They need to report any major accidents, including accidents anywhere. First and the foremost thing is they have to ensure timely correction of. Uh, can you just give me a minute?
Yes, ma'am.
Okay, I'll continue. Um, are you able to see?
Yes, ma'am.
Okay, I'll continue it. Fine. So, in the common treatment facility person, they have to ensure that they collect the waste regularly and on time. Now, there are certain things in the rules which says that an occupier of a hospital can complain against the common treatment facility person if they are not coming and taking the picking up the waste on time. Similarly, an operator can complain against an, that means a common treatment facility person can complain against the healthcare facility if the healthcare facility is not segregating waste and it is not providing the operator with segregated waste. Right? So both of them have to comply with the rules. It is not that rules are meant only for one person. All right, they have to establish a barcoding system. This is a issue of debate in many places. Some people say it is the common biomedical waste treatment facility, and some say it is the healthcare facility. But whatever it is, both have to implement these rules. One more thing is this barcoding system that needs to be present. If there is a system, there is this mechanism has been in place in many places. They have been smoothly operating. So both of them have to spend some amount of money to install that. There is a barcoding system that is there, and there is a tracking system. The waste needs to be tracked from the point of generation to the common treatment facility where it is taken care of. Right. And what is the other duty of an operator is that he or she should comply with the standards of emission, standards of treatment that have been laid down by the Central Pollution Control Board. Okay, they have to assist the healthcare facility in training of workers, and they need to upgrade the existing incinerator to achieve the standards of for the secondary chamber. So these are some of the rules which are mandated, or these are some of the activities that are mandated by for the operator. Okay, are we clear here? Now, what will happen if we do not um, comply with the rules? There are some penalties that we need to pay for it. Both the operator as well as the occupier both have to pay a penalty. It is not just meant for one. Now, finally, what is the thing that they look for is whether you are an operator or an occupier. You will have to manage waste in such a way that it will not cause harm to the environment or the health of the people. So, that is the most important thing that we need to look for. Right. So, what is it that the rules have put in place for us for monitoring mechanisms? Rules have also stated some monitoring mechanisms also. Um, uh, they have at the state level. Now, which is the regulatory body for this biomedical waste management? Can anybody tell me? Whom we call it as regulatory body. That means who basically see that whether these things are happening or not, whether the biomedical waste management is happening or not. Which is the body which looks after this? Yes,
State
please.
Pollution Control Board, Central Pollution Control Board.
Yes, this is State Pollution Control Board. What does the State Pollution Control Board basically do? They only monitor whether it is being implemented appropriately or not. Now, have you heard of Central Pollution Control Board?
Yes, ma'am.
Yes. What does the Central Pollution? What is the role of the Central Pollution Control Board?
They are
State
creating
Pollution.
guidelines.
Yes. Please repeat.
They are creating the guidelines, policies.
They create guidelines, they create the rules, and then they say for monitoring what all should be done is what is done by the Central Pollution Control Board. That means the policies and rules are the ones where the Central Pollution Control Board looks after. The State Pollution Control Board looks at implementation of these policies or implementation of these guidelines at the state level. Okay. Now every state, and there is this MOF, Ministry of Environment Forest, where all the environmental issues comes under this ministry. They are the ones who basically create the rules and regulations for everybody, whether it is environmental law. BMW rules actually comes under Environmental Protection Act. It is only a very small part of that particular act. So they ensure that the aspects of the act and the rules are being implemented all over the country. They have monitoring mechanisms. They have to bring out with guidelines, policies. All that is done by the Ministry of Health. Ministry of Environment, Forest, and Climate Change. All right. Now, at the state level, you have the State Pollution Control Board. But what will the State Pollution Control Board do? It will only come with a stick and penalties that you have not done this, you have not done that. All right. Now, for us, we also need somebody to advise in terms of how to go about doing it, what are the changes that needs to be done, and whether the implementation is being done appropriately or not. For that, as per the rule itself, there is something called as the State Level Advisory Committee. What is the role of the State Level Advisory Committee is to oversee the overall implementation of biomedical waste management rules in that particular state. And who are all the who is the chairman for this? The respective state secretary or the health secretary will be the chairman for this. And who will be the members of this advisory committee? They will include representatives of health environment, urban development, animal husbandry and veterinary science, state pollution control board, urban local bodies are, sorry for the spelling mistake, it is corporation representatives, representatives from IMA, that is the Indian Medical Association, representatives from the Common Biomedical Waste Treatment Facility, any non-governmental organization which is working in the biomedical waste management field or the waste management field. So all these are members, and anytime they can hire an expert member also along with them. They can ask for an expert to be a part of the state level advisory committee. Right. So all these members, what do they do basically? They will ensure that it is being implemented correctly all over the state. So they have to monitor the minutes of the meetings or the records that they get from the district level monitoring committee. And wherever there is a lacuna, they need to supervise and make those changes ready. Now that is at the state level. At every district there is a district level monitoring committee. Now one state level committee cannot look after all over the state, especially big states like Maharashtra or Karnataka. Of course, Andhra Pradesh has now been split into Telangana and Andhra Pradesh. So if there is a big state, everywhere the state level committee cannot be there. So therefore, at the district level you have the district level monitoring committee. Now, what does this district level monitoring committee does is the same thing. It supervises. That means they should have the inventory of all the healthcare facilities that are available, all the common treatment facilities that are available. Um, any new hospital or a healthcare facility that opens up should take permission from the district health authorities before they start off. So the list of all those things also should be available. Now monitoring, every state should consider as district level monitoring committee. Who all will be there in the district level monitoring committee? The district level medical officer or the health officer, district health officer, DHO. They have representatives from the regional offices of the State Pollution Control Board, Public Health Engineering Department, local bodies or municipal corporations, again representatives from Indian Medical Association, Common Treatment Facility, and any registered NGO which is working in the area of biomedical waste management can be a part of the district level monitoring committee. Now, what should this district level monitoring committee is that it should ensure that it is being all the common treatment facilities as well as the healthcare facilities are monitored. Now, I'm not sure how big a district for you will be. How much will be the population of a district, and how many healthcare facilities can approximately be in one district? Anybody, if you can tell me about your own districts, wherever you are from? Yes? Yes. Can somebody Are you able to see this? This is a Word document. Are you able to see this, a PDF?
No, ma'am.
No?
No, no.
Okay. Let me see if I can. Are you able to see now? Are you able to
Yes,
see
ma'am.
now?
Yes, ma'am.
Yes. Are you seeing this? There's a Word
Yes,
document. These are
yes,
duties
ma'am.
of an operator. This has been framed by the Central Pollution Control Board. Okay, this is a scanned document. So here the duties are given. Duties of the Central Pollution Control Board. What does they do? They do guidelines, they prepare guidelines and submit it, coordinate the activities of State Pollution Control Board, conduct training courses, lay down criteria for establishing common biomedical waste treatment facility, random inspection and monitoring of healthcare facility and common biomedical waste, review and analysis of the data submitted by the State Pollution Control Boards, on biomedical waste, submission of compiled information in the form of an annual report, inspection and monitoring of healthcare facility other than medical inspection rooms or sick bays, undertake or support research or operational research regarding biomedical waste. Now, the State Pollution Control Board, they have to have an inventories of occupiers and data of biomedical waste treatment generation, compilation of data and submission of the same, grant and renewal of suspension or refusal or cancellation of authorization under these rules, monitoring of compliance of various provisions and conditions of authorization, action against healthcare facilities for violation of these rules or common biomedical treatment facilities for violation of these rules. They have to organize training programs, uh, undertake or support research or operational research, any other functions under these rules as assigned, publish the list of registered or authorized recyclers, undertake the support of third party for audits of common biomedical waste treatment facilities in their state. This is for the Ministry of Health and Family Welfare. They have to grant license to the healthcare facilities establishment on a condition to obtain authorization from the prescribed authority for biomedical waste, monitoring refusal or cancellation of license for healthcare facility if they don't compile with the rules, publication of list of registered healthcare facilities regarding biomedical waste generation, treatment, and disposal, undertake or support operational research, coordinate with the state pollution control boards for organizing training programs, constitution of expert committee at the state level or national level for overall review, sponsoring of mass awareness campaigns, electronic media. So, as per the existing compliance, they have to verify. Now, anytime they come for monitoring, what they should do, there should be a monitoring mechanism. For armed forces, make healthcare establishment also there is a monitoring. The Director General of Armed Forces Medical Services are the prescribed authority, and they mandate a carrying out of monitoring. And CPCB is allowed to do inspection and monitoring of armed forces. All right. So, what is the monitoring mechanism? There is something called as self-monitoring or monitoring of CBWTF by the rules. So, whenever they're submitting their annual report, in the annual report, the generation, the quantity of waste that is generated is put, and also every hospital more than 30 beds should have a liquid waste management capacity. So whether they have compiled or complied with the standards of the effluent treatment is also that they need to provide it to the common when there is monitoring that happens. So when if it is an operator, say in an healthcare facility, what you do is only generate. So therefore, you will only get what is the weight of each of the category of waste that you generated. Segregation, you will have to maintain records. That means how many people have been trained, how many people have been given immunization, and how many times you have conducted the training. If there has been any accidents, that is what you need to write it down, and in the annual report also you will report the same thing. But whereas for an operator who's having a common treatment facility, for them they have to maintain how much weight of this waste of different categories they are getting. At the same time, if the technology that is most commonly used is our burn technology in terms of incineration. So how much weight of waste is being incinerated? Once there is incinerated, there's always emissions that come out. They need to maintain the record of what emissions that have been there. Now, as per the Central Pollution Control Board, there are certain parameters that they have to maintain. Particulate matter that is there in the emission, amount of carbon dioxide, carbon monoxide, or the sulfur compounds, dioxins and furans. All these things have to be monitored as per the emissions, and they have a standard that it should not go beyond this particular level. So these things have to be monitored every at a particular uh, periodicity, and those things have to be maintained by the operator. Now, one more thing, now with the help of technology, there is an online, or the internet is used for online monitoring of these emissions, as well as, since there is an autoclave which is also there, the temperatures and pressures of the autoclave also can be monitored online by the State Pollution Control Board for all the operators. See, they shall install a continuous emission monitoring system for parameters as stipulated by the State Pollution Control Board. Healthcare facilities also have to establish a system to review and monitor the activities related to biomedical waste management, either through existing committee or forming a new committee. Here, this committee can comprise of your nurse or doctors, or depending on your hospital, you can choose the people who would monitor the biomedical waste management or segregation and transportation within the hospital. That can always be monitored. You can have a checklist and say these are the parameters that are being monitored, and then see that segregation is being done at all the points of generation of waste. At every point of generation it needs to be monitored. Now, what does this green National Green Tribunal says that with regard to this, there is a gap analysis that needs to be done. Now, they have come out with a standard monitoring framework for common biomedical treatment facility, as for the operator. When they are monitoring the common treatment facility, what are the
तरबूजे
areas?
मैंगो खा लूं
Yes,
तरबूजे मैंगो ला दूं तकलीफ बाल दे दूंगी ना तो भैया ना या पढ़ाई भी नहीं नींद भी आ रही है पढ़ाई भी जरूरी है
please mute yourself. I'm not sure who's unmuted. Okay, so what we look at for monitoring of common biomedical waste treatment facility, you look at operational compliance. Operation means what are all the operations that they do? They collect, use of personal protective equipment, transportation, tracking and handling, and compliance to norms is what we look at operational. In terms of adequacy of infrastructure, that means vehicles, are they equipped with tracking facilities? Is segregation maintained in the vehicles also? Which are the areas of operation? Upgradation of combustion chambers. Upgraded APCDs is anti-pollution control devices. Waste reception. How is the treated waste being handled? All these things are looking at infrastructure, adequacy of infrastructure, and reporting of data. How much of data reporting is an essential requirement of CBWTF to report as per compliance of the rules and the service that are provided. So, as data is also essential to assess the gaps in waste generation, disposal, and trends in generation and compliance. So now you understand, when you are looking at monitoring of common biomedical waste treatment facility, you look at operational compliance, you look at adequacy of infrastructure, and you look at reporting of data. These are the three things that you look at whenever you are monitoring the common biomedical waste treatment facility. Whereas in a healthcare facility, what are all the things that we look for? First thing, there are first five steps: segregation, collection, pre-treatment, intramural transportation, and storage, which is exclusively the responsibility of healthcare facility. So what is it that there is monitoring? They see whether waste segregation happens in appropriate color-coded and bar-coded labeled bags, containers at the source of generation. Is laboratory waste and highly infectious waste, is it being pre-treated, right? Whether in-house transportation of segregated waste is being done to a central storage area, whether there is a temporary storage of biomedical waste in the central storage area, treatment of disposal of waste through common biomedical waste treatment facility or a captive facility. So these are the ones which are being monitored, aspects that are monitored in a healthcare facility. So, right, interim storage of biomedical waste is discouraged in the wards. It has to be stored in a temporary storage facility. No waste should be stored in patient care area and procedure areas such as operation theater. All infectious waste should be immediately removed from such areas. Right? In absence of dirty utilities, sections such as BMW must be stored in a designated place away from patient and visitor traffic or low traffic area. Now you understand, many a times our hospitals have been built even before these rules of biomedical waste management came in. So what do they do when these? What to do when there is no space? Now, whatever is the situation, you need to allocate a certain designated area which has to be under lock and key, and only authorized personnel should be able to operate that particular temporary storage area, right? If you don't have if you don't have a designated space which is already allocated, please designate one area where this can be stored before the common treatment facility person comes and picks it up. Now, in-house storage, what is there in this central waste? How do you take it? Many times, what will happen is we just use our hands. Sometimes these hands might be gloved or not gloved to just pick up these bags of waste and transport it to the common treatment facility person. So this should not be done. Usually, it should be using a trolley, because the chances of injury will be reduced if you use a trolley rather than not using it. And even in the trolley, also the segregation should be maintained. These trolleys or containers, they should have wheels, and it should be easily maneuvered. Even the healthcare facility also should report the data that is being generated there. So what are all the records? Records an annual report. See, category wise quantity of waste generated should be there. A weighing machine to weigh the quantity of biomedical waste. Records on annual report. Records with respect to accidents. Records with training. Maintain the annual health checkup of all the records of immunization indicating accidents. Okay, so effluent testing, record of recyclable waste handed over to authorized recycler. All these records should be maintained by a healthcare facility. Now I'll show you the formats whenever there is an inspection and monitoring that comes. One thing what we need to understand is all these aspects are self-reported. Whatever I said, these are self-reported by the healthcare facility and common treatment facility also. However, you can have anybody periodically visiting your healthcare facility or common biomedical treatment facility by the district level monitoring committee members or anybody appointed by them for verification. At least once a month, a physical visit is necessary, and quarterly inspection cum monitoring should be there, and inspection of dump sites and illegal sites, at least 4 random visits per annum, as well as whenever there is any complaint that is received by the district level monitoring committee, they have to do it. Inspection of biomedical waste collection and transport on random spot checks of vehicles or operation for 3 or 4 occasions in a year. GPS tracking daily they have to do. These are some things which have to do daily. Desktop monitoring of GPS tracking. In case there is COVID-19, we had a tracking app to look at it. Monitoring of barcode tracking, this has to be done daily. And this is online emission data which has to be done daily. Inspection of specific complaints as and when necessary, you need to look for all these aspects. These are some of the things what the district level monitoring committee does on a daily basis. All right, now it is just not that monitoring is enough. Sometimes there are many things, many a times what will happen is you will have complaints that we found some sort of biomedical waste lying here, lying there, specifically with fetuses, the ones which we have MTP done fetuses, or medicines, expired medicines being um, you know uh, dumped into dumping areas, or even into any water bodies. These are some of the complaints which are generally heard. So the district level monitoring committee should have a monitoring and complaint redressal mechanism, either through a web portal or any mobile app. They need to use social media platform to report incidents. They have to collect local intelligence from the field staff and conduct periodic random checkups and imposition of environmental compensation charges. So they have to develop a web portal of biomedical tracking, including integration of online monitoring of waste collection. So these are certain things which they have to do. I will go further in terms of what sort of monitoring or the checklist that are there. This is for the common biomedical: name and contact details, date of visit, where is the location, when was it established, who set up and who is operating it, contact details, total biomedical waste that is treated by incineration, that is treated by autoclave, and any other treatment and disposal uh, mechanisms that are using, and total how much they are treating in kg per day. Consent, whether they have a valid consent or not, under prevention of water pollution, air pollution, environmental clearance, authorization status, area of the common treatment facility, whether the annual report has been submitted, what are all the districts and cities that they have been covered, daily operation schedule, cost that is being charged to the healthcare facility, status of the infrastructure. So these are all the infrastructure. In terms of infrastructure, they will look at it. How is it? Whether there's a treatment space, adequate quantity, adequate storage space, separate space for treated waste, administrative room, generator set, security. There is parking facility, signboard, green belt, washing room, first aid box. All these things are being monitored. Lighting arrangement, odor problem, firefighting facilities are there or not, measures for control of pest, protective gear, telephone facility. These are all the infrastructure one that they look at. Next thing is your operational information. That means average quantity as per the record, how much yellow waste is incinerated, number of healthcare facilities, how many are bedded, non-bedded, number of beds, number of beds totally up to 75-kilometer radius, how much of waste in yellow category, red category, white, blue, collection and transportation, number of vehicles used, what is the condition of the vehicle, condition of the waste reception area, disinfection facilities, operating conditions of the autoclave, microwave, validation test used or not, operation of the autoclave or microwave, logbook, segregation of disinfected red waste, capacity of the shredder, yellow category waste disposal, whether do they have a primary chamber only or secondary chamber, two-stage incinerator, what is the feeding mechanism, is it automatic or manual, how much is the resident time, what sort of anti-pollution control devices have been attached, what is the fuel that is used, whether there is an online emission mechanisms that is there, that is shredding. What do they do with the white waste, that is the needles? How is the glass waste and metallic waste that is being handled? Facilities for storage of mercury waste, facilities for hazardous chemicals. What do they do with the wastewaters that is generated? Record keeping, are they keeping the records appropriately? Has barcode been implemented? Whether they registered, whether the vehicle is labeled or not? Is there a satellite center to store the waste? Where do they dispose of the treated waste? What do they do with the plastic waste? What is the frequency? So they have monitoring results of the parameter, the date, limit, total dioxins and furans, hydroxychloride, oxides of nitrogen, mercury and its compounds, all these things except particulate matter, all BOD, COD, even for your wastewater emission. These are some of the things that they look for in the common biomedical treatment facility. Look at what they look for the healthcare facility: address, telephone, month and year of establishment, how many beds they have, whether they have consent under Water and Air Pollution Act, whether they have authorization that is there, what are their operating timings. That means whether it's 9 to 4 or 24 hours or 9 to 5, annual report submission, housekeeping and sanitation, who are all the staff that are involved, annual report. Now, biomedical, where are all the sources, total quantity of waste that is generated, and what is the category? Say it is yellow category, human anatomical waste, how much, animal waste, biochemical waste, waste sharps, discarded medicine, soiled waste, solid waste, liquid waste, incineration. Ash may not come here unless they have a chemical waste also, they may or they may not come, depending on what chemicals they're using. Whether the record is being maintained, status of segregation and storage, status of temporary storage, whether temporary storage is satisfactory, treatment at wards, housekeeping, what is the mode of transportation within the hospital, provision made for on site transportation, category wise options that are there for them, on site treatment if at all they do it. Some of the PHCs do have this. If there is a deep burial, how much kg per day? If they have an incinerator, even that also has to be monitored. So on-site treatment by incineration, it will come as common treatment facility itself. The same thing is being implemented there also. Okay, fire safety measures, logbook for operation, all these things are also looked at. Right? These are the permissible limits, as you say: particulate matter, nitrogen oxides, sulfur, stack height, primary chamber temperature, secondary chamber temperature, what is the resident, what is the quantum of ash, for autoclaving and microwaving also. These are even for on-site treatment facility, what wastewater treatment, what is the consumption of water, sources of water, total wastewater generated, what are all the steps involved in the effluent treatment, types of chemicals used in the ETP, final mode of disposal of treated wastewater, compliance to the regulations. So this is infrastructure that is there. These are some of the things: record keeping, monitoring frequency. Okay, carried out. This is monitoring frequency within the hospital also, by the hospital. Whether waste are disposed of through common biomedical facility, then those details need to be given. Whether there's mixing that is happening, whether there are posters or not, whether special spillage is being taken care of, type of vehicle that is used, due to attention being given to vehicles to prevent spillage, pilferage. Facility operator collects daily or alternate day, whether it is 48 hours is complied. Other observations. So recommendations, signature of the official with the date. So this is in what you call in short about what are all the monitoring things that they're basically looking at. Clear? So now this is something with self-monitoring. I mentioned it already, right? Once in 6 months, every time they meet, ensure guidelines, revised guidelines for common biometric. These are some of the guidelines which the common Central Pollution Control Board has come out with. You can check them online. It is available on their website. Any of the guidelines you want, you can look for it. This is what it is: standard monitoring compliance. So by HCF, there are formats and checklists which I shared with you. Development of a web portal. These are my references. Thank you. Does anybody has any clarifications to ask me?
No questions, ma'am.
Ma'am, can I have this recording, class recording?
I'm not the regional center will give you the recording. I am not. I don't have the access to the recording. I'm sorry. I just logged off inadvertently. Is there anything I can clear anybody's doubts? I am. You're welcome here. Is there any clarification anybody wants to ask me? You're welcome. Is there anything anybody see? Even in your own hospitals, also you can establish your own monitoring systems. It is not necessary that somebody outside needs to do it. Periodically, you can get it from outside. Large hospitals definitely will have their capacity to do it. Even if it is a smaller facility, also you can have a mechanism where you say every Wednesday or Thursday I will check whether it is being done or not, check whether appropriately it is done or not. You can create your own checklist depending on the kind of waste that you generate, depending on the situations where you are in. You can definitely develop your own monitoring checklist based on what monitoring aspects the Central Pollution Control Board asks you to. Based on that, you can create your own checklist and then monitor them. If there is no monitoring that is done, invariably things will not happen in order, or it may go haywire unless there is a monitoring systems in place, especially about waste management. People may not follow it, so therefore it is important for you to establish a monitoring system there. Is anything anybody else would like to ask me? Okay, can somebody tell me what are the aspects that are monitored in in a healthcare facility as per the rules? Yes, please. What are all the aspects they look for whenever they are monitoring a healthcare facility?
Segregation is occurring properly or not, ma'am?
Hmm?
Segregation, yes, segregation is occurring properly or not? Whether the waste is collecting in color-coded bins or not,
Yes. Then
and handling of the waste, transportation of the waste inside of the hospital is properly followed or not.
yes.
and annual reports are prepared or not,
Mm-hmm.
and whether it is sent to the district pollution control board or not, ma'am.
Mm. So all these aspects are, they look for infrastructure, they look whether the systems are in place or not. Where is the segregation happening? Is it at the point of generation or somewhere else? And whether the people have been trained, whether the annual immunizations have occurred or not, or occupational safety is being maintained. These are some of the aspects that are done at the healthcare facility, right? Anything else? Anybody has anything to ask?
No, ma'am.
Yes, please go ahead. Is there any doubts anybody wants? Somebody wanted to raise, Mr. Ravi Kiran, I think.
No questions, ma'am.
No questions?
Yes, ma'am. No questions.
That's all. Sure. Can we call it a day? Sir, host, can I log out? Okay, right. Then I'll call it a day. If there is any clarification, you can still write to us and find out. Thank you very much.
Thank you, ma'am.
Thank you.